Phase 3 movement is where Greg is going to release the ball. In the picture, he is just about ready to release the ball. This phase is where he has the most force, power, and strength behind his throw of the ball. In the glenohumeral joint, the starting position is extension, ending position is flexion, movement is flexion, tension is concentric, and the muscles are the anterior deltoid, coracobrachialis, and the pectoralis major. For the scapulothoracic joint, starting position is depression, retraction, and downward rotation. Ending position is elevation, protraction, and upward rotation. The movement is elevation, protraction, and upward rotation. The tension is concentric. The muscles are the levator scapulae, upper, middle, and lower trapezius, rhomboids, pectoralis minor, and serratus anterior. For the elbow, the starting position is extension, ending position is extension, movement is no movement. It is an isometric tension, and the muscles used are the triceps brachii and the anconeus. For the radial ulnar joint, it starts in anatomical position, ends in anatomical position. There is no movement. Tension is isometric, and you use the supinators, the biceps brachii, and the brachioradialis. For the wrist, the left wrist is in anatomical position, and the right is in extension for starting position. Ending position, the left is in anatomical, and the right is in flexion. The movement is left, no movement, and right, flexion. The tension is concentric. And you use the flexicarpi radialis, flexor corporal ulnaris, and palmaris longus. The finger joint, the starting position is that left is in slight flexion, right is in flexion. Ending is that left is in slight flexion, right is in flexion. The movement is left is slight flexion and right is flexion, and the tension is concentric. He uses the flexor digitorum superficialis, the flexor digitorum profundus, and the flexor pollicis longus. For the cervical spine, it starts in anatomical position, ends in anatomical position. There is no movement. It is isometric, and he uses his bilateral splenus cervicis and capitis and bilateral erector spinae. For the lumbar spine, it starts in anatomical position and goes to slight extension. The movement is extension. The tension is concentric, and he uses his bilateral quadratus lumborum and bilateral erector spinae. For his hips, the starting position is anatomical, left, and it goes into left flexion and right extension. The movement is left flexion, right extension, and the tension is concentric. For the left, he uses the bicep femoris, the semitendinosus, the semimembranosus, and the gluteus maximus. And for the right, he uses the sartorius, pectineus, iliopsoas, rectus femoris, and tensor fasciae latae. For the knee, it starts in anatomical position. The left goes into slight flexion. The right goes into extension. The movement is left flexion, right extension. It is a concentric movement, and he uses, for the left, his bicep femoris, semitendinosus, semimembranosus, and popliteus. And for the right, he uses the vastus lateralis, vastus medialis, vastus intermedius, and rectus femoris. For the ankle, the starting position is anatomical. The ending position is left anatomical. The left is in anatomical position. The right is in plantar flexion. The movement is left, no movement, and right, plantar flexion. The tension is concentric. And for the right, he uses the gastrocnemius, the soleus, the posterior tibialis, flexor digitorum longus, flexor hallucis longus, peroneus longus, and peroneus brevis. For his toes, he starts in anatomical position. He ends with the left toes being in extension, the right being in flexion. The movement is left extension, right flexion. Tension is isometric, and the muscles are the extensor digitorum longus and extensor hallucis longus.